Bring your foot back to your rear.
There we go. All right, buddy. Dr. Erickson, Dr. Buchta here. We are going to work on this young athlete's knee. Quick background story on this is in the fall of last year, in the basketball season, probably around October, November. That sound about right, P?
Yeah.
Okay. Had some left anterior knee pain. Okay, so right in the front, right below the kneecap. Trouble with jumping, trouble with explosive movements, which basketball is. I mean, it's jumping, changing direction, sprinting. Of course, he was told to rest. You got some tendonitis. Tried a bunch of things, and it doesn't hurt him all the time. It only hurts him when he does explosive things. He can walk. He can go up and down stairs. But the problem with him is it's deep in that tendon. It's maladapted. It's misformed and mishealed. And now when he wants his body to perform some high-end and aggressive maneuvers like jumping and landing, it hurts. He can't play basketball. And rest is not going to fix this thing. We have to get in there and remodel that tendon. So right now, Dr. Buchta is actually actively flexing, so bending and straightening that knee while he's, I'm going to change the angle here so I can get on top of you. So while he's applying pressure to that tendon.
Last one here. All right.
So you can see this is a very common area where the inferior pole of the patella, so that patella comes down, the tendon starts right there, and the tendon attaches on that bump right there. And anywhere in there can get it irritated.
I'm going to scoot out just a hair. All right, so I'm going to do a little Graston with motion here.
Okay, I'm going to try to get to a spot where I can...
All right, just maybe do a little squat here for me.
There we go. So now what he's going to do is he's going to use a little tool.
Come back up.
There we go. So as he's moving through that range of motion and making that tendon work.
Again, come back down.
So when he comes down,
Any pain here?
No.
he's essentially eccentrically or negatively loading that tendon. It's lengthened right now. And then when he comes back up, now it's shortening. And it's not on stretch now. See how much movement he gets in the knee there. It's nice and loose.
Again, pop back down.
When he comes down, now the tendon is tight. Just like that. Doesn't take a whole long time. We just have to apply the right forces to that tendon to get it to remodel and the type 2 collagen and the good type of tissue to heal down rather than the nasty collagen and fibrinogen that creates a bad scar, which is what's hurting him.
Three times, keep it straight, relax that.
This is an example
Take it straight and relax that.
of an extremity knee adjustment.
Working a little on the tibia.
Mm-hmm.
It's a little fast stretch on that pop. What is?
He's got a board that has a little bit of a spring loaded, and then as you push down,
All right.
that's what the sound was, the board just giving way and moving. All right, so now after the chiropractic part of it, we're going to incorporate that with some physical therapy. And in his situation, I want to work on more eccentric loading of that tendon. To start with, we'll slowly get from eccentric into concentric, meaning eccentric will be the negative. I want to lengthen that tendon as we go with an applied load or force on the ankle. And then concentric would be more the positive, like kicking the leg straight. So what he has trouble with is the jumping. Last week, it's been a week. He started with just some very basic loading of that tendon and sitting. I'll show you that in a second. I want to get a baseline though here first again of the squat. He had pain with squatting last time, pain with jumping. He played over the weekend up in Minnesota and it was much better? Yeah. Okay. So it's already we're making changes to get this tendon reloaded because he's young and healthy, so it's going to change. All right, so squat real deep, show him what we got. So before that would hurt when we did that. How much pain there now?
Not very much. It's really not much.
2, 3, what number was it?
2.
Okay, last week we were probably, I think 5 or 6. We did it last week on Monday. Is that what we said?
Yeah, like 5.
Kind of 5, okay. All right, step here. So here's what we're gonna do. We're gonna show you the movement that we tried last time. So he's got long legs, so I raise the table up real high. Now there was weakness in this tendon when he was performing these movements. When I had a band back there with his ankle weight, he had a real trouble getting it up there and then lowering down, almost like it was shaking, and he had to help the other leg. And that's just from the tendon. The muscle's not weak, it's just the tendon was not properly healed. So we're gonna start with some weight here. All right, I'll kick that all the way straight. Not too bad. Okay, down slow. See a little bit of shaking there. So on the way up, that's the concentric or the positive phase. So come all the way up. Okay, on the way down slow, that's the next. Here's the eccentric. It's lengthening as we come down. Okay, I want to work more eccentric, so we're going to add more weight, and then we're going to have his other leg or my hand help him on the way up. I don't care about the way up right now. Oh shoot, we'll put on your foot. It's not going to fit. Okay, so use your other foot, and we're going to help it up to add. So we're going to use the right leg as the assist. He's going to hold real tight, 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 and then down slow. Down slow, down slow, down slow, and then relax. So what I want here is I want him to reproduce the pain, the symptom that he feels right there. In anywhere between 4 and 6 out of 10 to make that tendon remodel in the body to lay down new scar tissue to new collagen. This is one way to do it, is eccentrically you're loading that tendon in a negative way. So go ahead and come up again. He's going to help it up. So he's using that leg to start it with, then transfer the weight over here, hold, down slow, work it, work it, work it, work it. Rest. How much pain on that one way down? Between 4 and 6 or not?
Probably like 4.
Okay, keep going. So we're going to do 10 this way, and then I'm going to just work, as this heals, eventually he won't have much pain as he does this. It'll be a 2 or 3. Then you got to add more weight. You got to put another 5 or 7 pounds on there to get it back up to that 5 to 7, or 4, between 4 and 6 out of 10. So you're consistently over time, adding more and more weight and remodeling that tendon so it heals. And then he'll be able to do, like he was already feeling better with jumping over the weekend. Give it 4 more weeks of healing, and he should have no trouble jumping, changing direction. So, all right, we're gonna work on this. We'll pause that, and then maybe if there's one other thing, we'll show it to you. Thanks. Okay, one thing I forgot to add. In tendon problems, typically there's what's called a painful arc. Whether it's a shoulder or in this case it's the knee, when he's down here, there's no pain down here, right, really? And then go ahead on the way up through it. And there's really probably not much pain up here at this end range. Now it'll go down, it'll be no, there it is, because it's kind of falling, keep going. And then once he gets past it, then it's gone again. Same thing happens in his squat. When he's squatting, he's like, not there, there's pain, and then once he gets low enough, then the pain goes away again. So it's just in a very specific arc of movement, and you'll see it a lot with the shoulder too, where it'll be no, yeah, there it hurts, and then it's past it, and then it's gone again. So just think of it that way too. If you ever have that painful arc, consider that it might be a tendon. Okay, so I'm going to use the TRX bands next to do more of a weight bearing or a loaded movement for that tendon. It's more specific and more functional anyway, because he's a basketball player and you play basketball with your feet on the ground, not sitting on the edge of the. If you're sitting on the edge of the bed, that wouldn't be good, because you'd be on the bench, right? If you're sitting, so that's not good. So that's a good one to start with. And now I'm going to have him do a single leg squat, loading that left leg. The arms are here to help him. So he will again eccentrically or negatively use the leg down, ouch. And he'll use his arms to pull himself back up, okay? So he'll come down slow, the painful arc, there it is. Then he's past it, it won't hurt, and then he'll use his arms to pull himself back up, okay? Go at it, man, get it.
I hope.
Not as easy as it looks, I know.
No, yeah. How do you, so just.
Yep. Down, use that tendon. Feel it?
Yeah.
Yep. And then use your arms, or other leg, push it back up too if you have to.
Right.
There you go, use your other leg, then that's fine. Leg and arms. So that shows you how that can be weak when it's injured. Okay, so come down slow, and you can use your other leg if you have to. Loading, pain there? Mm-hmm. Yep. Okay, and then push all the way back up with your other leg and your arms. Yep. And if it hurts, if it's too hard, don't go quite so low. Okay, just go to where the pain stops, and then come back up. pain stops there, then yep, yeah, there we go. Okay, perfect. So this is higher. This is harder than what the thing before because we're using this body weight now. Before I had maybe 8 or 10 pounds on there. So there's that even easier on that one.
A little bit.
Okay. How much pain with this one?
A lot more.
A lot more?
Yeah.
Okay, then use 2 feet. I mean, still have most of your weight on this side, let's say 80% and 20%, and there you go. Or just put your toe behind, put your toe like that, so you have a little bit of weight on that side, and try to use mostly that one. There we go. Better that way?
Yeah.
Okay, yeah, so you don't want too much, but it can't be like 7 or 8 pain, it's gotta be between 4 and 6, because if I have him reintroduce an inflammatory phase here where it's too aggressive,